Welcome to this CogX talk. We're going to be talking about, what next in the world of mental health, particularly global mental health with the post-pandemic era. The pandemic has exposed and potentially even deepened the wounds of ongoing mental health crisis. And I'm going to be discussing all of this and what lies in the future with Professor Vikram Patel. As an introduction, Professor Patel is a psychiatrist and global health expert. Professor Patel went to medical school in India, underwent training in psychiatry here in London, and has worked in developing countries around the world, including Zimbabwe. In 1996, Professor Patel co-founded the Mental Health and Research Centre Sangath in India, where he continues to work on evidence-based research projects. Professor Patel has pioneered incredible work, including evidencing that mental health illnesses such as depression are not confined to developed countries such as here in the UK, but are in fact experienced across the world, sometimes under different labels and understandings. He has many accolades and awards. We could probably talk all day about those, but notably he was awarded the John Dirks Canada Gairdner Global Health Award and was also recognised in the Time magazine's 100 Most Influential People. Good afternoon, Professor Patel. I think we'll dive straight in if that's okay. How big is this global issue of mental health?
Alex, first of all, thank you very much for inviting me to be part of this festival. So let me first start off by saying, what do most people think about when they hear the word mental health? I believe that I think most people think about mental illness, and we conflate these two terms. In fact, when you therefore look at the science, the evidence around mental health, in fact, what you're left with is evidence around mental disorders. So let's just first acknowledge that mental health and mental disorders are quite different. In fact, mental health isn't just even just the absence of a mental disorder, but most of the knowledge we have, most of the data we have is around mental disorders. In the realm of mental disorders, we have to then acknowledge that we're talking of an incredibly diverse group of health conditions, all the way from things like autism, ADHD, and intellectual disability in childhood, through to conditions like mood and anxiety disorders, trauma-related disorders, substance use conditions, and the psychosis in adulthood, and of course, self-harm and suicidal behaviors. And then I would also consider the neurodegenerative conditions associated with psychiatric manifestations such as the dementias and old age, also part of that whole range. And so if you put all of those together, this incredibly diverse group of health conditions, anywhere but between 10 and 20% of the world's population is living with one or more of these at any given point in time. And you can do the math here. You know, we're talking about 1 billion people or more on the planet today. But you asked me the question, how big is the problem of mental health? Well, if you treat mental health as it should be, which is a dimension that ranges from well-being at the one end through to disorder at the other, something which is our greatest personal asset and something that we live with at every single moment of our lives, whether we're awake or we're asleep, the numbers of people who might have their mental health impaired for one reason or the other is, of course, even greater than that.
I think it's. I think you allude to something very important there. The idea that we all have mental health. You know, it's on that kind of spectrum, and everyone has different experiences. And I guess something that we've talked about probably more than ever in recent kind of months and a year or so has been, our well-being, our mental health, the impact of the pandemic, I guess, on our own experiences of life. And from your kind of expert view of global health, how much of an impact, or is there a true impact on on mental health around the world because of this pandemic?
Oh, absolutely, there is, Alex. And I see the impact of the pandemic on mental health in two different phases. The first phase is the acute phase, the phase in which the pandemic itself is sweeping across the population and taking many lives with it. Obviously, every country is at a different stage in terms of the pandemic itself. I'm thinking about one of the countries in which I spend a lot of time, which is India. The second wave has been, it's basically spawned what I consider the world's greatest humanitarian crisis. There's been a calamitous impact of the second wave. And if I think of what's happened in India in the last 2 or 3 months, I think I would really describe it as a collective trauma. If you think of trauma as a major determinant of mental health, we often think of trauma only in terms of very violent or unnaturally extreme incidents. But actually, trauma at its heart is characterized by the toxic effects of extreme fear, uncertainty, insecurity, and helplessness, combined with grief and a sense that actually you're on your own. If you think of trauma in that sense, trauma has swept across India. It probably swept across Britain a few months ago. It swept across US, many more months ago. And in that context, this acute effect of the pandemic is to raise the population prevalence of distressing psychological experiences. And of course, that will mean pushing more people into the clinically significant range. But I will say that the impact that I worry about more is in fact the impact that will, I fear, unfold in the weeks and months ahead as the economic consequences of the pandemic begin to bite deeper. Let's not forget that back in 2008, when there was a financial recession, which very specifically hit the US more than any other country, the economists Angus Deaton and Ann Case have documented an actual reduction in life expectancy in America, particularly affecting working age Americans. And what was that driven by? That was driven by essentially substance use and suicide-related mortality. So I think we do need to be very conscious and worried about the economic impacts on the mental health of the population. And of course, hopefully we'll talk about what are the things we can do about averting those, given that we can almost predict that this kind of negative effect is certainly plausible.
From your experience, because obviously you're talking to me from Boston at the moment, and you work between India and over there, and of course with Harvard University as well. What are the comparisons that you've drawn in your time, or what are you seeing kind of on the ground, if you like, or hearing the difference between, for example, India and a country like the USA?
Well, it's an interesting question, Alex. Most people think there's really nothing similar between India and the US. Here we have the world's wealthiest countries and one of the world's poorest countries. If you look at the place that these two countries have on any index, say, for example, Human Development Index, the US is usually in the top 10, and India is usually in the bottom quintile of countries. But actually, having lived and worked in both countries, I see enormous parallels. And the real key parallel that unites these countries is the almost perverse levels of inequality in both countries. And for me, inequality, by this I mean income inequality, is one of the most profound social determinants of poor health and well-being, and of course mental health is one of them. Also, in both countries, you see another kind of stratification, which is to do with race in the US, or caste and religion now in India. In the way societies have become polarized. In both countries, you see very populist leaders who have successfully, strove to actually divide populations according to characteristics like caste, race, or religion. And of course, another thing uniting both these countries is that the healthcare system is incredibly fragmented, where the private healthcare system plays a very dominant role. Neither country has the kind of universal health coverage that you in Britain enjoy. The NHS, which I had the great privilege of working in many, many decades ago. And I think all of these serve to explain why both of these countries are likely to be hit much worse by the health consequences, both of the pandemic as well as the mental health consequences of the pandemic in the years ahead.
I think it's fascinating to see, and think about, because when we initially thought about COVID, you think about the physical side of it, the obviously immediate deaths, but there is clearly, and worryingly potentially an ongoing impact on the mental health, which also, of course, plays closely with people's physical health. I wondered, going on from conversation around the kind of links between economics and mental health, could you talk a little bit about this idea of a treatment gap when we're talking about mental health in countries?
Sure. Well, first of all, can I just say something about the point you made earlier about inequalities? It's also important for me to emphasize that the mental health consequences of the pandemic, like the medical or the direct virus-related consequences, are not equitably distributed over the population. Of course, that should be obvious to you and to all our listeners, is that these are disproportionately affecting those who have been historically disadvantaged. Low-income populations, as a great example, but also other groups, for example, women, who have found themselves in places like India, not only locked in at home and having to work from home, but in patriarchal systems. They're also now exposed to greater threats of domestic violence and also other multiple responsibilities, as their children are households at home. So the mental health impact on women is likely to be much worse than it is on men. And I'll tell you one more group that we often don't fully acknowledge is young people, adolescents and young people whose entire lives have been thrown under the bus. But more importantly, we also know that this is a critical phase in the life course, a unique developmental phase when most mental health problems emerge. Our listeners should know that 3/4 of all mental health related morbidity in adult life arises before the age of 24. And there are lots and lots of good reasons for this, not just the enormous transitions that we make during this phase of life, but also very unique neurodevelopmental changes that we've only come to understand in the last 10 or 15 years. Now, you asked me about the treatment gap. So similarly, the treatment gaps are also disproportionately distributed. There are huge differences in the treatment gaps, say, in the US and in India. In the US, for example, approximately about 50 to 60% of people with mental health problems don't receive evidence-based care. In India, that proportion increases to 90 or 95%. And in some parts of India and sub-Saharan Africa, I would say it's about 100%. Now here, it's important for me to emphasize that when I'm talking about evidence-informed care, I'm talking about biomedical care. And of course, that is not the only kind of care system available for mental health problems.
Now, I mentioned the huge amount of work that you've been doing, and one of the things that I'm very much interested in is this idea of task sharing, and maybe what we can learn from the work that you've been doing, and how that might apply to wealthier countries, maybe like the USA or the UK. Could you talk to us a little bit about that?
Yeah, absolutely. For me, Alex, the fact that here in the US, where more money is spent on mental health per capita than any other country in the world, which enjoys generally almost every metric, more mental health resources than any country in the world. The fact that even in this country, and most of that money, by the way, is spent on mental health specialists, because mental health care is largely about people. The fact that even in this country, such a massive proportion of people do not receive care, and that every metric of mental health, whether it's the burden of mental health problems, the suicide mortality rate, etc., every metric is getting worse. And this is even before the pandemic, suggests that the model of care that we have embraced over the last few decades, which is to say a model of care which emphasizes the diagnostic approach, which then leads to a biomedical, very narrow biomedical, clinical interventional approach, typically led by mental health professionals, is not adequate. It wasn't adequate before the pandemic, and it will be completely inadequate in the post-pandemic era. On the other hand, let us ask questions about how do less resourced countries actually address any health problem. For me, the greatest innovations in healthcare delivery arise from the least resourced parts of the world that seek to deliver quality care to the last mile. And the singular innovation that has arisen from the less resourced world has been the emergence of a much more plural and diverse health workforce. And in that, community health workers, of course, are outstanding examples. So task sharing is simply the sharing of essential healthcare tasks with non-MD, non-specialized health practitioners, typically people who are working in community settings, have a direct contact with people in those communities, live in those communities, speak the same language, and who have the ability to be trained to deliver a range of healthcare tasks, from delivering babies or delivering tuberculosis treatment, or in my case, adapting that for the delivery of psychological and social interventions for people with mental health problems and for their prevention.
How important will this be, in moving forward now in this post-pandemic era? How important is this, to kind of get started in the now? Because I guess the worry is, a lot of the talk at the moment, amongst mental health experts, particularly here in conversations we're having, is that there's a crisis upon the crisis looming, and the time is to act now. How quickly can we start to make these changes, and how important are they?
Well, one of the interesting things, Alex, you asked me about how relevant is it for the wealthy world. Sometimes I think, we often think of global health as being about people in less resourced countries. For me, the essence of global health, of course, it applies to everyone everywhere. That's why it's called global health and not tropical medicine or international health. And at the heart of global health is the notion of disparities. And disparities in the area of mental health, you can see in every country of the world, as we discussed earlier. So the emergence of innovations like the use of alternative So where I got cut off, I was simply saying about the importance of thinking of task sharing as something that applies to all countries everywhere. And here in the US, one of the most exciting things that I've embarked on in the last year is a program to bring the innovations that have come from low-resource countries like India, Zimbabwe, and elsewhere to the US. What's interesting is that the US has a huge army of paraprofessionals, including community health workers, which might surprise some of your listeners. And over the next year and a half, and the years ahead, actually, we're about to embark on a really audacious experiment to bring mental health care through community health workers in the US, starting with a very exciting program that we've launched with collaborators in Texas. And our focus is going to be to take brief psychological treatments that have been demonstrated to be highly effective when delivered by community health workers in India and several other countries. We're going to use digital platforms to train frontline workers to then provide peer support and supervision for quality assurance to deliver the same treatment adapted for the US. Think about that. The treatment was developed in India. It's being adapted for the US. Usually you hear
incredible. Incredible.
Over the months and years ahead.
I'm very excited by this notion of task sharing, because one of the things I'm working on at the moment here is alongside the members of the Mental Health Coalition from Young Mind, and so on, is to try and develop early support hubs. So what we'd like to do is have centres in every community which has youth workers, employment advice services, counselling services, life coaches, all under one roof, including sexual health services actually as well, under one roof, which would be a self-referral, a drop-in basis, so that young people under the age of 25 can actually access early intervention. I guess it kind of takes some of the principles you're talking about, that kind of getting some of these skills into the community and having that kind of youth wraparound service. So we've actually launched this campaign. I'm very much hoping the government might fund and back this. Quite excited by the idea, I guess, of getting the community together on board with this idea of mental health and well-being.
Absolutely, Alex. Well, a couple of things about the idea that you described, which I think really embrace the notions of global mental health. The first is that these are community-based and not clinic-based, and it's extremely important to emphasize that we need to meet people where they are. To me, that's the essence of global health. We don't need to meet people where the doctors and nurses are. We need to meet them where they are. Secondly, when you're talking about young people have been historically the demographic who are least likely to go to the hospital. Let's be clear. When I was young, I mean, the characteristic of being young is this feeling of invincibility, and seeking help from a professional is the last thing on your mind. So therefore, having a service that's available in the community, oftentimes led and run by young people, is a very important aspect of engagement. And the third thing is that typically these one-stop places provide a multitude of services. And the historic splitting of mental health, both from physical health, but also from social well-being, has been, in my view, one of the greatest problems with the biomedical approach to mental health care. But on the other hand, what you describe brings together all these diverse areas of health and well-being, including social determinants. And I believe that is, in fact, an exemplar of how mental health care should look in the future.
Well, I can't tell you how excited I am to have your support of that, and I think it's we're really hoping, campaigning hard. We're hoping that we can bring some of these changes. Now, keep an eye on the clock here and the time. We have time, a little bit of time for questions, of course. So if you have questions for us, please do jump into the chat and send them. But something else I'd like to ask you now. What is the kind of roadmap, I guess, in terms of global mental health? We talked a little bit about community-based. What is the future, and how do we get to a stage where that treatment gap closes, that people are actually getting the, I guess, support that they need around the world with regards to mental health?
Well, I think first of all, when we're talking about treatment and care, I think the evidence-based approaches are clearly showing that we need collaborative care that connects mental health specialists with a range of different forms of community-initiated care. And in the latter, I think we need a lot more investment and resources, but I want to distinguish at least three connected layers of community-initiated care. The first is self-care, something that every individual around the world must be equipped with skills to manage your own mental health. The second is equipping people who are working in community contexts, not in the health system, but who are in a sense first responders for both early intervention as well as long-term care. This includes, for example, people working in the child welfare area, teachers in schools, and so on. And of course, a third group is the one we talked about earlier, which is community health workers who are linked to the healthcare system and can be equipped with even more skills for treatment and recovery. So having a collaborative care model is the most evidence-based one, in which primary care, community-based care, and specialist care work seamlessly together so that no individual falls between the stools, and one can care for individuals across the whole spectrum of needs, from well-being all the way through to extremely disabling mental health problems. But I want to say one more thing, and that is about prevention. We haven't talked much about prevention in the mental health space, but I want to emphasize to our listeners, that is not because we don't know what are the origins of mental health problems. We have focused too much in our origin story on genes and on biology. But we've forgotten that there are many powerful social determinants that have been demonstrated time and again to lead to poor mental health in adult life. And the most important one of that is adverse experiences in early childhood. This is the smoking gun in mental health. And what we need to do is to demand a society in which every child has a fair start in life, where every family, especially low-income families, families that experience enormous social and economic disadvantage, are supported by the state, because those are the circumstances in which poor mental health will ultimately show itself in later life.
Very important and powerful point there. I'm going to jump in with a question from our chat now, if that's okay, Professor. We are told there are lessons from the COVID pandemic for dealing with other global crises like climate change. How can we prepare for this? And by this, I guess I mean the mental health crisis.
Well, I think, one of the most important lessons we can take away from COVID was the over-reliance on highly sophisticated hospital technologies. If you remember, when the pandemic broke, all the conversations were about ventilators and, intensive care. Now we know that the overwhelming majority, more than 99% of people with COVID actually need non-pharmaceutical interventions and home-based care. So therefore, rebalancing again our understanding of what should the pyramid of healthcare look like, I think that to me is an extremely important lesson. In India today, probably the single most important workforce for the containment of COVID is not the pulmonologist in the ICU. It's the humble frontline worker who in India we call the Asha, who is going from door to door in many parts of the country, helping people quarantine at home, helping people identify who is sick, helping people with the vaccination.
Absolutely. Actually, if we can jump back for a second to the well-being, I would like to talk to you a little bit about that, because actually I'm today in South London. I'm after this talk going to be filming with some other experts around well-being, making some well-being videos for every school in the UK, actually, just basics around self-care. And I think it's something we have talked about a lot during this pandemic, people getting outside, natural light, look after yourself, take care of yourself. From what you said, and I hope this is true, is it actually something that we can take control of? Is self-care something that really can help, prevent maybe mental illness, or at least, help us, deal with it if it happens?
Absolutely, of course it can. I mean, I think there's a plentiful evidence around that. I mean, for example, the strategy you described, which is being able to engage in some kind of physical or recreational activity. And obviously, again, this is disproportionate. The opportunities are disproportionate, right? I mean, if you live in neighborhoods with a park, for example, then you can engage in that much more easily. But I think all of us, no matter where we live, can engage in some form of physical or recreational activity. These are very powerful self-care skills. The other one I would emphasize is sleep. The very strong association between sleep and mental health has been demonstrated time and again. And so therefore, sleep hygiene is an extremely important self-care skill. And there are plenty of others. But I want to also emphasize we should never see mental health as a one-size-fits-all. We must recognize the dimension of mental health, because it means that no matter where we are on that dimension, there are a range of different things we can do. At one end of the dimension, self-care might be all we need, but there might be individuals who are at the more unwell end of that dimension who need additional support.
Absolutely. Now, there are, of course, people in society who have been disproportionately affected by the COVID-19 pandemic. And I've got a question here, I guess, relating to healthcare workers, with regards to mental health, an important conversation. are there any statistics or surveys related to mental health status in healthcare workers or in other carers that work directly with COVID-19 case management? And are there support systems for them? Well, I might mention before you jump in, there's actually was a survey done by the Association of Surgeons. And if I quote, I hope I'm quoting correctly, that when they did the survey of a huge number of trainee surgeons, that somewhere between 70 to 80% of them were either showing signs or symptoms of potential burnout, anxiety, depression, or other mental health illnesses, which is believed to be exacerbated, obviously, during this pandemic. But I just wonder what your take was that on Professor Patel.
Well, absolutely, Alex. The data you describe, I think it's, wherever people have examined the burden of mental health problems in healthcare workers, you find very similar results. And it isn't surprising, right? Because again, by healthcare workers, let's be very clear, we're talking about a very plural and diverse workforce here. It's not just doctors and nurses. You will find that this is the frontline workforce that, while the rest of us who have the luxury of staying at home and pivoting to digital working, this was the workforce that couldn't do that. This is the workforce that had to go into work because that's where you actually manage COVID. And so there was intense fear about actually being exposed to the infection, bringing it home to your loved ones. And twinned with that was the other very traumatic experience of watching death in many cases like you've never seen before. And making very, very difficult clinical decisions, for example, when resources were scarce, for example, oxygen, about who should get it. These are the sorts of decisions no one wants to be to be put into a place to have to make at any point in our lives. So I think there's no surprise at all to me that the burden of mental health problems is much higher among healthcare workers. There are many initiatives that people have taken, for example, here at Harvard Medical School, simply listening circles in which doctors and nurses can meet regularly with a professional who is able to facilitate group conversations, all the way from that to actually also having, the provision of mental health care for those clinicians who are experiencing distress, having significant amounts of time off and so on. There's a variety of different strategies that people have adopted.
It's amazing actually how much change there's been during the pandemic and how much focus has been on staff and frontline staff in terms of mental health. If you look at the hospital I'm in, Lewisham Hospital, which is in southeast London, a very busy department, and actually throughout the pandemic we've been hit pretty hard, I would say, by COVID. Some of the strategies that we've implemented as an A&E department, we actually created a wellbeing room, a space where, if you saw a really difficult case, maybe you've seen someone pass away or you're distressed, having a space, a quiet space that's not clinical, that's not lit in a clinical way, that you can have time to sit with a staff member or take some time out. We now have wellbeing champions and first aid staff, not just doctors, as you said, people all the way across the spectrum within the department who are there to kind of support people. And I think that's really positive. And I really hope personally that we learn from this and we actually do more, because in previous winters, we've had very hard winters in A&E. And I think the stress of frontline workers isn't a new thing, but I hope that we maybe catch up a little bit and do more work in this area.
Alex, one of the things that the pandemic has brought to the fore is the opportunity of telemedicine. A lot of these, I would imagine many of the things you just described are being done remotely. Certainly in here in the US and in India as well. All mental health care has pivoted to telemedicine platforms. Think about this. About a year and a half ago, if I told you that all psychiatric or mental health care would be done remotely, you'd have laughed at me and said, "That's
no way."
How quickly the world has embraced this, and I hope that amongst the things that I hope that we do not abandon as society opens up is the use of telemedicine, not least because it is so incredibly friendly for patients. It means you don't have to travel to the hospital. It means that people living in rural and remote areas who don't have access to a clinic can still get mental health care. It means that the few specialists that are often concentrated in cities can now serve a much larger swathe of the population. So I believe telemedicine is a very important innovation that I think would transform mental health equity in the years ahead if we continue to invest in it.
It is incredible how human beings, even in the most difficult times, that we learn to adapt and innovate and find ways to kind of move forward, I guess. Now, as we're drawing to the end of this conversation, I would love if we could talk a little bit about how people watching, people listening could help with the work you're doing? Obviously, you've been at the forefront of global mental health for many years. How can people who maybe aren't in that space, aren't working within the mental health space, or those that are, how can we help with what you're doing?
Well, I think first of all, it's important to say that 25 years ago, I would have asked all the listeners to demand more action on mental health through their legislators, through their political representatives. Today, I will say that this is a historic opportunity for mental health, because conversations on mental health are coming from the top. Almost in every country, political leaders outside the mental health sector, and that's important for me to emphasize, are talking about mental health as a very important need for the population, maybe only second to making sure that the pandemic is well and truly beaten. So this is a historic opportunity for society to come together and implement the evidence-based solutions that I have spoken about a little earlier, in particular shifting our emphasis that historically has focused on narrow biomedical models of mental health care. And by the way, I'm not saying those aren't important. All I'm saying is that we need a sensible rebalancing of our resources, of our energies, so that we begin to focus now much more on community-initiated care, because that is where we will be able to actually shift the needle on reducing the burden of mental health problems going forward. It isn't only going to be by focusing on the tip of the pyramid. So this is where I would really call for action from all our, and of course what this means is our listeners don't need to be mental health professionals to be involved. Mental health is everybody's business. I hope that if there's one message that comes in this conversation, is that it is everybody's business, and there is something each and every one of us can do, both to promote our own mental health, but to be part of a more plural workforce, not in a narrow sense of a workforce, but in the broadest sense that we are engaged in supporting the mental health of our community members.
Well, I think that's a very positive note for us to probably end off. Thank you so much, Professor Patel, for your time, and everyone as well listening today. And I guess, an important note to finish on, we all have mental health. Let's look after ourselves and the people around us. Thank you very much. I hope everyone enjoys the rest of the talks at CogX. It's an honor for me to be invited. And again, thank you, Professor Patel.
Thanks very much, Alex.